Welcome to the extension module. My name is Dr. Javier Carlin, physical therapist, and in this module, we're going to be covering extension biased. And what this means is you've realized that anything that involves you bending forward has caused you some pain, and when you extend backwards, you actually feel better. And what this means is that typically when you are either bending forward to pick something up off the floor, whether it's a heavy object or your grandchild or your kid, whether it's after a long day of sitting at work, perhaps at your desk, perhaps you are driving and your pain increases. Any of these movements where your lower back posture might be compromised, specifically in the position of flexion going forward, is a great indicator that you are extension biased. So if that sounds like you, if that's something that you've struggled with, if you've had symptoms in the past with any of those movements that I just mentioned, whether it stays in your lower back or goes down your leg, which we call peripheralization. If it stays in your back, we call centralization. If it goes from your back to from your leg to your back, that is what we call centralization. So that is what we want to happen. We want any pain that goes below your knees or below your buttocks, we want to make sure that it's localizing to your lower back and eventually from your lower back to nowhere. Okay, so if that sounds like you, then you're in the right module. We're going to go ahead and cover several different movements that should be performed in the order that we demonstrate to you. Okay, a few things to take note. Some of these movements are going to be a bit more uncomfortable, and they may cause some temporary pain in the beginning. Okay, as long as it's not excruciating or intense pain and it resolves rather quickly, we're going in the right direction. Okay, a few other things to consider. If you've been dealing with lower back pain for 3 months, 6 months, a year, or years, sometimes you will not get instant relief, and you might need to continue to perform the movements and exercises for at least 14 days to start noticing a difference. Okay, so just because you don't get immediate relief instantly does not mean that it's not working. You just have to continue on with the program, and again, make sure to ask us any questions if throughout your journey you are not seeing the results that you'd like, because we can always go back to the program and see exactly what we have to do or change, or there might be something else that we need to take a look at. Okay, so with that said, those are the things to consider. If you are doing this for pain relief, you want to go close to the edge of when the pain is going to start, if not a little bit in the pain. Okay, if you are doing this for range of motion, you want to push and go as far as you possibly can, even if there is a little bit of pain, okay? But ultimately, we do want you to be pain-free, so we should always have the intention of going for pain relief first before we try and get full range of motion. We do want full range of motion, but not at the expense of you being in more pain, okay? So with that said, in each of the next 4 videos, we're gonna go ahead and tell you exactly for how long and for how often you should be doing the movements that we're going to demonstrate to you, okay? Again, as I said before, if you have any questions, please make sure to ask myself, Javier, or Jenny, and we'll be more than happy to answer any questions that come about. Thank you so much. Enjoy the videos, enjoy the exercises, and happy extending.